what is a rare disease? A rare disease is one per definition, which 1 in 2,000 persons at maximum suffer from. All right, that's a rare disease. Epilepsy, as a whole, is a common disease. Between 0.6 and 1% of the population in the Western countries suffer from epilepsy, so it's very common. On the other hand, there are so many different etiologies and so many different comorbidities in persons with epilepsy that you could see epilepsy as a sum of rare diseases. So, why is it important to know if somebody suffers from a rare disease? There are several aspects. One is this may enable you to tailor the treatment for this person. For instance, if you find a rare disease with a genetic origin, then you may be able to find drug treatment in the sense of precision medicine. The other thing is rare diseases have a meaning for self-advocacy in patients because there are so many self-advocacy associations for different rare diseases, and there are certainly more to come. And it has also a political dimension because many governments are in the process of paying more attention to patients with rare diseases. So many university hospitals have centers for rare diseases, for instance. And rare diseases have also an importance in the allocation of research funding. Having said that, I would like to tell you a little bit more about epilepsy centers in the German-speaking countries, and probably that's certainly that's not restricted to the German-speaking countries. It's similar in a couple of other European countries. So there are epilepsy centers at the university hospitals, and these centers are those who gather in associations for the research on rare diseases in epilepsy. On the other hand, there are several traditional epilepsy centers. They have their origins in the 19th century. Most of them are foundations from the Protestant Church, so they come from a Christian tradition, and they have a strong academic interest, but they are not university hospitals, or at least they have not a universitary tradition. For instance, looking at our hospital, the Bethel Epilepsy Center in Bielefeld, Germany, we have been appointed a university hospital around 2.5 years ago, but our history is more than 150 years. And these traditional epilepsy centers care for many persons with epilepsy and probably with rare diseases with a comprehensive care perspective. So we undertook this study in 3 of these traditional epilepsy centers in Germany and Switzerland. So this is the Epilepsy Center Kehl-Kork in the southwest of Germany, and it is the Swiss Epilepsy Center in Zurich, Switzerland, and it is our center, Bethel Epilepsy Center in Bielefeld, Germany. And so we picked by random 1 week in the year of 2021, and we searched our databases for the prevalence of rare diseases within this given week. So in total, we were able to include 504 patients. Little bit less than half of them females, and 44% of these 504 patients, 222 patients, suffered from a rare disease according to the Orphanet definition. So going a little bit more into detail about the diagnoses, we had patients with mesial temporal sclerosis. Well, you could argue as a criticism, well, I didn't think mesial temporal sclerosis is a rare disease, but it is one according to the definition of the Orphanet system, which we normally use. So then there are a few of the genetically determined syndromes like Dravet syndrome and tuberous sclerosis complex. There is also the Lennox-Gastaut syndrome, one of the top diagnoses of rare diseases in this week. And others I would like to mention are the juvenile myoclonic epilepsy as a form of idiopathic generalized epilepsy. It's isolated focal cortical dysplasia, and a couple of other diseases. So in conclusion, we found that rare diseases are highly prevalent among the patients of traditional epilepsy centers. And besides the meaning for the individual patient, we think that these centers should play a role within the research organizations and associations for rare diseases, and these centers should be considered for research funding.